stroke occurs when the supply of blood to the brain is reduced or blocked completely, which prevents brain tissue from getting oxygen and nutrients. Causes: stroke occurs when blood supply to brain is interrupted or reduced. This deprives oxygen and nutrients supplied to the brain, causing brain cells to die. Some people may experience only a temporary disruption of blood flow to the brain. Stroke may be caused by ischemic stroke. The obstruction to blood flow is usually due to a thrombus or an embolism within the blood vessel. Hemorrhagic stroke. Hemorrhagic stroke is a type of stroke that follows bleeding in the brain. Transient ischemic attack. TIA is caused by same conditions that cause an ischemic stroke like thrombosis, embolism, or other conditions like arterial dissection, arteries, or hypercoagulable states. TIA does not leave lasting symptoms because blockage is temporary. The risk factors include overweight, sedentary life, binge drinking, diabetes, smoking, high blood pressure, high cholesterol, family history of stroke, cardiovascular diseases. People above age 55 are at higher risk. Gender: men are at high risk of stroke than women. Diagnosis: to determine the most appropriate treatment for stroke, an emergency team needs to evaluate the type of stroke a person is having and the areas of brain affected. Physical examination: patient's symptoms, medical history, blood pressure and blood vessels at the back of the eyes are checked. Blood test: to find out time taken for clotting of blood. CT scan: images of brain can show a hemorrhage, tumor, stroke, or other medical conditions. Ultrasound: to check the blood flow in the carotid arteries and to check for plaque, if any. Magnetic resonance imaging (MRI). MRI of brain tissue to diagnose ischemic stroke or brain hemorrhages. Cerebral angiogram. Dyes is injected to get detailed view of brain and neck blood vessels visible under X-ray. Echocardiogram. To check for any sources of clots that could have traveled to the brain and lead to stroke. Treatments. Treatment is based on the type of stroke. For ischemic stroke or transient ischemic attack, medication or surgery or both can be recommended, and for hemorrhagic stroke, surgery is recommended. Complications. Stroke may lead to severe complications, paralysis or loss of muscle movement. Patient may become paralyzed on one side of the body or lose control of certain muscles, such as those on one side of face or one arm. Difficulty in talking or swallowing. Memory loss or thinking difficulties. It also affects thinking, making judgments, reasoning, and understanding concepts. Emotional problems. Stroke survivors may develop depression. Changes in behavior and self-care ability. Stroke survivor may become more withdrawn and less social or more impulsive. They may need help with grooming and daily chores. Prevention. Many stroke prevention strategies are the same as the strategies to prevent heart disease. In general, some preventive tips for stroke patients are follows. Diet and healthy eating. Following a proper diet may avoid the risk of second stroke. Decreasing the amount of cholesterol and saturated fat in your diet. Controlling diabetes. Monitoring blood pressure. As high blood pressure exerts continuous pressure on the walls of the arteries, it may lead to arterial block. Avoiding illicit drugs. Exercising. Consult your doctor before starting an exercise program. Quit smoking and alcohol.